Hi, my name is Candace Hingston, and I'm an infectious disease epidemiologist specializing in the development of a new diagnostic test for Hingston Labs. The focus of this diagnostic test is a newly discovered strain of meningitis called Burgundy meningitis. Today I would like to provide an overview of the test accuracy and explain how you can share the results with patients. Burgundy meningitis was discovered after an outbreak on campus at the University of New England. Burgundy meningitis, which is a highly contagious bacterial strain, twice as infectious as Haemophilus influenzae or Hib, is the known agent of the endemic. Typical flu-like symptoms are present in just under 25% of known cases, and the dark red rash associated with the infection appears only 1 to 2 days before more severe complications arise. Because the disease has a slightly longer incubation period of 7 to 10 days, it is possible to do early diagnostic tests once screenings have been performed. At Hingston Labs, we have developed the Hingston Modified Sputum Test, a diagnostic procedure for this disease. It can detect Burgundy meningitis using saliva samples from individuals of any age and is a painless alternative to the only other known diagnostic test, which uses imaging that requires intravenous dye. The results from the latest population-based sample of 10,000 people are shown here. The results show that of the 10,000 tested, 1,274 individuals tested true positive, 7,243 individuals tested false positive, 126 individuals tested false negative, and 1,357 individuals tested true negative. The sensitivity of the Hingston Modified Sputum Test is 91%. The ability of the test to identify positive individuals with Burgundy meningitis is high, which shows that the test can be a good indicator for disease detection and will be useful in identifying infections early on in the incubation period to avoid severe complications. The specificity of the diagnostic test is 15.87%. The ability of the test to identify negative individuals without Burgundy meningitis or the true negative rate for the test is low. However, with this test, when an individual is identified as negative for the disease, it is likely to be an accurate result. Since sensitivity and specificity are inversely related, the specificity is expected to be somewhat lower. The positive predictive value for the test is 14.96%. As noted by the high sensitivity but low specificity, it's more likely to produce more false positives than actual cases of infection. This is a drawback of the test. However, the negative predictive value is 91.5%. With a negative predictive value of 91.5%, we can confirm that the majority of individuals testing negative for the disease do not, in fact, have the infection. This is an important rate, as missing the infection during testing is much more futile for a disease like Burgundy meningitis than receiving a false positive. So how can you explain results to patients? The most accurate way to explain the test and the results to patients is to inform them that this is a less invasive and more cost-effective method of ruling out the possibility of having Burgundy meningitis. Although the test has a high rate of false positives, it is also very good at identifying patients without disease. Also be sure to inform each patient that the results of this test or any test are not 100% accurate. Our suggestions regarding positive and negative results are as followed. If results come back negative and symptoms have not worsened, patients should schedule a follow-up with their physician after 5 days and self-monitor for worsening symptoms. During the follow-up call, the physician should decide if the patient should be cleared of possible infectivity, retested by another diagnostic procedure, or treated with antibiotics. However, if results come back positive for a symptomatic patient, the individual will need to be subjected to more invasive diagnostic testing or immediately begin treatment. Due to the likelihood of false positives, the progression of other diagnostic testing methods should remain at the doctor's discretion. Care for high-risk individuals should be given priority, as more aggressive treatment may be necessary. Report positive test results to the proper public health entities to assure accountability and reduce reporting errors. Thank you for being a part of this overview of the Hingston Modified Sputum Test.